Hey guys, how you doing? We are going to talk about patient assessment skills. We're going to talk about this because from now on, every training, when it starts, is going to talk about the subject. And at the end of the day, we're going to go to the patient assessment and we're going to talk about it right now, which is going to be included in every training. Okay, first thing you're going to do is the scene survey. You're going to do check for the scene for safety. Okay, you gotta begin while still on the ambulance. You gotta still look outside and make sure where you're gonna go. If you are in a place where there is fire, you gotta make sure where you park, where the smoke is. If you are on the highway, you gotta see where the cars are coming from, all that good stuff. And then you gotta make sure that you got BSI. That means you got a glove, gown, mask, eye protection, anything that you want. You wanna know the MOI or the NOI. You want to know what's the mechanism of injury or the nature of illness. Mechanism of injury if there is a trauma, the nature of illness if it's medical. Number of patient, do we need ALS or VLS? Number of resources that you need. And that is going to be your first time to consider calling for more resources. Okay, after all that done, we're going to start our initial assessment. In that initial assessment, we are going to correct life threats. First thing you got to do is you're going to see his general impression. His general impression is how we're going to get that. You're going to look at the environment. You're going to look at the chief complaint. You're going to look at his appearance. If he needs a C-spine stabilization, make sure you do it. After that, you're going to take a look at his mental status. You're going to talk to him. You're going to see if he is alert. If he is alert to verbal or to pain, or he's totally unresponsive, you're going to use your AFO on that one. Okay, then you're going to check his airway. Make sure if you need to open it if necessary. Clear it if necessary. Use an adjunct if you have to. Breathing is, does he have adequate chest rise and the rate of his breathing? Okay, if you have to assist him, go ahead, or maybe give him some O2. His circulation, you're gonna take a look. If he has, you're gonna control your major bleeding right away. You're gonna take a look at his skin condition, as his pulse. Determine if patient is priority to transport. Immediate transport against further delay, or just work with him unseen, then move him back. At this point, we're going to start working, we're going to determine if our patient is a medical or trauma. Medical patient, and we're going to talk about a responsive patient. What we're going to do is we're going to do focused history and physical exam. History, we're going to take a look at the present illness, and it should be applicable to the chief complaint. We're going to do the onset, we're going to do the provocation, the quality, the radiation, and the severity. Okay, this is what we're going to do with that. We're going to get a sample history. We're going to do the signs and symptoms. We're going to do the allergies. We're going to see his meds. We're going to talk about past medical history. And we're going to see last oral intake and event leading up to incident. Now we're going to start the focus physical exam to affect body part or system. We're going to work with whatever he is complaining. You got to make sure that you have baseline vital signs. Okay, we're going to take a look at his pulse, rate and quality, blood pressure, systolic and diastolic, respiration, rate and quality. And we're going to do if we need any transportation. Now, our medical respect, we're going to talk about medical patients that are unresponsive. Okay, that's your second time to request ALS if not already done. Okay, focus history and physical exam right here. Now we're going to do a rapid physical exam. Okay, we're going to check the head, the neck, the chest, the abs, the pelvis, the extremities, and the posteriors. We're going to do all of them. We're going to do decap PTLS on all of them. When we get to the neck, I want you to see if there is JVD or if there is crepitation. The chest, I want you to start listening to breath sound and see if there is crepitation. Abdominal, I want you to see decap BTLS, then I want you to see firmness and distension. On the pelvis, you're going to do the decap, but also you're going to see if there is distension, or compress gently down and see if everything is okay, feel it out. Extremities, you're going to do on all of them decap BTLS, but you're going to do the distal pulse and you're going to do motor and sense. You're going to see if there is PMS on it. On the posterior, just take a look on decap BTLS. Okay, let's talk about baseline vital signs. When we do the pulse, I would like you to see the rate and the quality. When we do blood pressure, you're going to take the systolic and the diastolic. Respiration, the same thing. You're going to see the rate and the quality, and both of them on the pulse and the respiration, you are taking it per minute. Okay. Now, history of the present illness. Okay, you're going to interview bystanders and family. You're going to see onset, what is the provocation, the quality, the radiation, the severity, the time. Then you're going to do sample history, signs and system, allergies, medication, past medical history, last order, event leading up to the incident and intervention and transport. Now, medical or trauma, you're going to decide, and then you're going to keep going with the ongoing assessment. Repeat initial assessment, reassess the record vital sign, repeat focus assessment, check intervention.